We are joined now by Dr. Atul Gawande. He is a surgeon at Brigham and Women's Hospital in Boston and a professor at Harvard Medical School. He also is a member of President-elect Joe Biden's new coronavirus advisory board, and that's why he's here. Dr. Gawande, very good to see you. Let's talk about the Thanksgiving travel.
See you.
The CDC has made it very clear if you want a happy Thanksgiving and you don't want to have a very unmerry Christmas, under no circumstances should you travel. That said, you see people at the airports. You see people lined up at clinics to get the COVID test in anticipation of getting ready for Thanksgiving. What's your message to them this morning?
I'm with the CDC. I think that we're in a tough place right now. It's over 3 million people who are actively infected in the country. When we're gathering at Thanksgiving, the risk of exposure, especially in whether it's in airports, train terminals, bus terminals, those are high. So taking into account that advice, I think what we know is we're in a tough place. Next year, next Thanksgiving and Christmas will be in a very different place, but right now this is where we are.
And even if you get tested today, it doesn't help you for Thanksgiving next Thursday, right?
Well, that's right. I mean, look, if we must get together, you want to keep the folks you're gathering with smaller than we might normally in the holidays. Second, you would love to crack a window. Third, you would love to make sure you've quarantined for the last about 2 weeks ahead of time, so you make sure you don't pass it along. A test can help during that time, ideally as close as possible to the date. But, you know, really, the evidence is that if you gather with 10 or more people, we're upwards of 1 out of 100 people having an infection right now. So that means many families will have someone infected, and they often don't know it, capable of passing this coronavirus along. We need to have that as a strong message coming from the very top across the country. This is not a partisan issue. The virus just doesn't care.
Dr. Gawande, President-elect Biden has urged the Trump administration to provide his transition team with critical information about the pandemic. What is your biggest concern about this delay in the transfer of power?
Well, we have two massive undertakings to address. Number one is understanding, just as the new president-elect team takes over, what's the status of masks and gloves, our hospital beds, our resources for taking care of people. I'm talking to people at state level, local level, hospital level, nursing homes, who are reporting shortages of staff. About 35% of hospitals are short of staff in 8 states. Are we addressing that? And then you add on the vaccine distribution. Do we have the syringes? How are we going to allocate? Who gets first? You know, state officials don't have that information and that plan underway, and yet they're being told, be ready in 2 to 3 weeks to start distributing vaccine. Yeah. That plan isn't there, and we need to know about it. And what are the supplies? Are we going to run into shortages over time? That handover, this is one of the most massive undertakings. It can't just be dropped in the lap of the next administration.
The HHS secretary was here earlier, and he said the CDC is staffed by career diplomats. They'll keep things going. All the information is public. Everything you want is out there. Is that true?
And he said it's not costing lives.
It's absolutely not true.
Yeah, he said it's not costing lives. Yeah.
It is absolutely not true. This is dangerous. Look, there are basic amounts of information that you just can't land in your lap to understand. Here's a case in point. There was a plan for 300 million doses to be available at the end of the year. What they're reporting now is 20 to 30 million doses available. Why? Where are the bottlenecks? What are the shortages? How are they addressing them? And what are the gaps that then the next administration needs to fill? That alone means delays that could cost lives, and getting ahead of it could save millions of people, tens of millions of people, a chance to get the vaccine sooner.
So you don't think the president-elect is exaggerating when he says this could cost lives?
There is no question. Look at it this way. We have deployed about 100 million tests over the last 8 months, as one of the governors in the meeting with President-elect Biden pointed out. We're now trying to deploy 330 million doses of vaccine to people twice in the next year, and trying to accelerate it happen in months. there hasn't been anything like that undertaken. You don't just simply hand that over and think that everything is going to go smoothly. We need planning and coordination.
Okay, before you go, have you been told when these conversations will begin?
They will begin the minute that the General Services Administration ascertains that President-elect Biden can speak to the agency officials, and the transition team, those of us advising them, can speak to those officials. That doesn't happen until the GSA rules that is the case. The president, current President Trump, is putting a lot of pressure to not allow any of these meetings to happen.
All right, Dr. Atul Gawande, thank you so much for your time this morning.